and what they could mean for your overall liver health. Not just a quick glance, but a real, careful look. Because what you see there might surprise you. Most people never think to connect their feet to their liver health, but medical professionals are increasingly recognizing that the feet can reveal important warning signs of liver problems long before more obvious symptoms ever appear. In fact, by the time fatigue, jaundice, or digestive issues show up, liver stress may have already been building for months or even years. Your body is constantly sending you signals. The liver is one of the body's most vital organs, quietly working behind the scenes to filter toxins, regulate hormones, and support digestion. Most people associate liver problems with symptoms like fatigue, yellowing skin, or digestive discomfort. But here is something many overlook entirely. Your feet may actually be one of the first places your body sends warning signals when the liver is under stress. The connection between liver health and circulation runs deeper than most people realize. When liver function begins to decline, changes in blood flow, nutrient absorption, and toxin processing can all show up in unexpected ways, including right down at your feet. A doctor reviewing patient health data confirms this connection is well documented and worth understanding clearly. Now let's get into the warning signs, starting with number 1. Take a close look at the lower legs. Do you notice small red or brown spots on the skin? These shiny discolorations, sometimes described as having a slightly metallic or glazed appearance, are worth paying attention to. While they can result from minor skin trauma or aging, they can also be linked to poor circulation and metabolic changes associated with liver dysfunction. When the liver struggles to process waste and regulate blood flow properly, the skin on the lower extremities can begin to reflect that internal stress. These spots may appear gradually and are often dismissed as harmless. However, when combined with other symptoms, they can serve as an early visual clue that something deeper may need attention. Moving to the second warning sign, take a close look at the feet and ankles. You may notice thin, web-like blood vessels visible just beneath the surface of the skin. These are known as spider veins, and while they are often dismissed as a cosmetic concern, they can sometimes point to something deeper. When the liver is under stress, it may struggle to properly regulate hormone levels, particularly estrogen. As estrogen builds up in the body, it can cause small blood vessels near the skin surface to dilate and become visible. This is especially noticeable around the feet and lower ankles. Research suggests a connection between impaired liver function and the development of these visible vascular changes. If you notice spider veins appearing without explanation, it may be worth discussing with your doctor. The third sign to watch for is persistent cracked heels. Now, this might seem like a simple skin issue, but there is actually a deeper biological connection worth understanding. When the liver is under stress, its ability to produce adequate bile becomes compromised. Bile is not just a digestive fluid. It plays a critical role in helping your body absorb fat-soluble vitamins, specifically vitamin A and vitamin E. Both of these nutrients are essential for maintaining healthy, supple skin. Without sufficient absorption, the skin on your heels can become dry, thickened, and prone to deep cracking that simply does not heal with regular moisturizer. So if you have been dealing with stubborn cracked heels despite consistent care, your liver health may be worth discussing with your doctor. The fourth warning sign may be one of the most uncomfortable, and it often goes completely unexplained. If you have ever experienced intense, persistent itching on the bottom of your feet without any visible rash or allergic reaction, your liver may be trying to tell you something important. When bile flow becomes disrupted due to liver stress or damage, bile salts can build up in the bloodstream rather than being properly processed and eliminated. Once these bile salts reach the skin, they trigger nerve endings and cause a deep, maddening itch that no ordinary cream or lotion seems to relieve. This condition is medically known as cholestatic pruritus. The itching tends to worsen at night and is most commonly felt on the hands and feet. On screen, you will see this labeled as itchy feet, our fourth warning sign. Moving on to the fifth sign, watch as this person massages a painful, aching heel. Foot pain and inflammation can sometimes be more than just a mechanical issue. While many people immediately think of plantar fasciitis, persistent inflammation in the feet may also be connected to broader metabolic stress happening throughout the body. When the liver is under strain, inflammatory markers can rise, contributing to discomfort that seems difficult to explain through physical causes alone. You will notice the on-screen label reading foot pain or inflammation. Now, this does not mean every sore foot points to liver trouble. These signs are most meaningful when considered alongside other symptoms we are discussing in this video. Context is everything when it comes to understanding what your body may be trying to tell you. Moving on to the 6th warning sign, hot or sweaty feet with a strong odor. You might notice this after a long day, but it could mean more than just tired feet. When the liver becomes overwhelmed, its ability to filter and neutralize harmful substances begins to slow down. As a result, the body may attempt to compensate by pushing some of those toxins out through the skin. This can lead to increased sweating, unusual warmth, and a noticeably stronger odor coming from the feet. On screen, you will see this labeled as hot or sweaty feet with odor. The liver plays a central role in detoxification, and when that system is under strain, even your feet can become an unexpected outlet for what the body is trying to eliminate. Now we arrive at the 7th warning sign, and this one is particularly important to recognize. Watch closely as the doctor presses gently on this swollen ankle, leaving a visible indentation that slowly fades. This is called pitting edema, and it is more than just ordinary swelling. When fluid accumulates in the tissues of your feet and ankles, it can sometimes point to something deeper happening inside your body. The liver plays a critical role in producing albumin, a protein that helps keep fluid balanced within your blood vessels. When liver function declines, fluid can leak into surrounding tissues. Swelling in the feet or ankles may also relate to circulation or kidney concerns. If you notice persistent indentation after pressing your ankle, please speak with your healthcare provider as soon as possible. The 8th and final warning sign is toenail fungus and skin changes. As you can see in this close-up, affected toenails may appear discolored, thickened, or brittle. But why would this connect to your liver? When liver health declines, it can disrupt both gut balance and immune function. These two systems work closely together, and when either is compromised, the body becomes more vulnerable to fungal overgrowth and persistent skin issues. The liver plays a central role in filtering harmful substances and supporting immune defenses. So when it struggles, infections like toenail fungus may become harder to fight off and easier to develop. Keep an eye out for any unusual nail changes, especially alongside other signs we have covered. Next, we will explore the everyday lifestyle habits that may be quietly placing stress on your liver. Now that we have walked through 8 warning signs your feet may be sending you, it is worth understanding what drives these symptoms in the first place. Several everyday habits can quietly place enormous stress on your liver over time. Sugary drinks flood the liver with excess fructose, forcing it to convert that sugar into fat. Alcohol, even in moderate amounts, disrupts liver cell function and slows detoxification. Processed foods loaded with refined oils, additives, and sodium create chronic low-grade inflammation that the liver must constantly manage. Certain medications, including over-the-counter pain relievers taken regularly, can also burden liver pathways when used long-term. Each of these habits connects directly to the circulation problems, nutrient deficiencies, fluid retention, and skin changes we discussed earlier. Understanding the root cause is the first step toward making meaningful changes for your long-term liver health. This video is for educational purposes only and is not a substitute for professional medical advice. Start by filling your plate with nutrient-dense foods like leafy greens, carrots, and beets. Reduce processed sugar and limit alcohol consumption. Stay physically active with simple habits like daily outdoor walking. Drink plenty of water to support your body's natural detoxification process. Cook more meals at home using whole ingredients whenever possible. Your liver is remarkably resilient, and supporting it does not require dramatic changes. Remember, your body sends early warning signals for a reason. Pay attention to them. If you noticed any of the signs discussed in this video, please consult your healthcare provider promptly.